Hi, good evening, everyone. I hope I'm audible. I Can you please confirm if I'm audible and if I'm visible? All right. All right. So let me begin. Right. So let me begin with today's part two of pharmacology quiz time. Yesterday we had done few questions, and today I'm going to continue with some more questions which have been frequently asked before, and we are going to discuss those questions as usual and the topics around that. Okay, so whatever is important, we are going to cover that along with the previous questions. So because it's a quiz thing, you need to answer as and when the question comes, so that we know and you know basically where your level of preparation is and what you need to focus more on, right? So before I get on with the questions, few mandatory announcements are that we have this Unacademy subscription, which is Unacademy Gold, and the target is your next batch or the FMGE batch, and the offer price for the next batch is for 9600 and FMGE is for 4400, right? And this actually is only for a limited time. So the second offer is for FMG 2023 batch, which is a 3 months course and 200 plus hours of sessions. And these are very high yield revisions, and you'll benefit a lot from that because they have doubt solving lessons and MCQs and whatnot. Again, the offer is very good on this. It is 4400 only. Then the next one is your target, which is your next or NEET PG 2024, and this would include, it's a longer course, 7 months duration, where theory is there and the practice sessions are there. So a lot of classes which will be targeting these, and 400 plus hours of all the important content you'll get, and this is only for rupees 9600. All right. So make use of the best of these offers, whichever suits you, and let's march forward now. So let's continue with the first question for today evening. Is hi, good evening, Vinod Thagan. How are you? All right, guys. So let's do this first question. Longest acting phosphodiesterase inhibitor among the following drugs is? Dr. Raj says 3, tadalafil. All right. Very quick response. Tutora says C. Okay. Great. Any other options? Responses. Ankita says 3. Very good. Pranav says C. Alright, so all of you are on the right track. Very good. It is your tadalafil, right? So it is tadalafil. And can you tell me the shortest acting over here? Tadalafil is the longest acting. Shortest acting here is? Which is the shortest acting out of these? So shortest acting is your? Yes, Dr. Raj. Excellent. Sildenafil. Okay? So shortest acting is sildenafil. And sildenafil, 4 hours half-life. Tadalafil, almost 14 hours. So these are the two phosphodiesterase inhibitors, and their use is in the erectile dysfunction and pulmonary hypertension. One of the important drugs for erectile dysfunction as well as pulmonary hypertension. And tadalafil is also said to benefit in benign hypertrophy of prostate. Right? So let's do some of the other phosphodiesterase inhibitors that you have done in pharmacology. So can you name a phosphodiesterase 3 inhibitor? Any phosphodiesterase 3 inhibitor. Phosphodiesterase 3 inhibitor. They're also called as inodilators. This is a hint I'm giving you. They're also called as inodilators. That means they have an inotropic effect plus they have a vasodilatory effect, because phosphodiesterase inhibitors, very good. Amrinone, yes, amrinone, right? Milrinone, very good. Milrinone, amrinone, and they are useful in the congestive heart failures, right? So this is phosphodiesterase 3 inhibitor. And next is phosphodiesterase 4. Phosphodiesterase 4 inhibitor. This is roflumilast. It is roflumilast. Okay? Roflu specific I'm talking about. Otherwise, theophylline is also a non-specific phosphodiesterase inhibitor. It's a non-specific one, you can write. But phosphodiesterase 4 specific is roflumilast, and it is used in COPD or asthma, bronchial asthma. Okay? Resistant cases में, severe cases में we use them. Then phosphodiesterase 5 inhibitors. So all these drugs which are ending with phils, right? Sildenafil, vardenafil, tadalafil, all these are your phosphodiesterase 5 inhibitors, which we've done, just per question tha. Now, coming to here, let me pause a bit यहाँ पे. Sildenafil, because they are very important drugs. So sildenafil, apart from inhibiting phosphodiesterase 5, also inhibits phosphodiesterase 6, and therefore it leads to visual disturbances, right? Visual disturbances. Another important thing here is that they should not be given with nitrates, right? They should not be given with nitrates, because nitrates have a similar action. They're going to increase the amount of cyclic GMP, and they're going to cause smooth muscle relaxation. So there'll be drastic decrease in the BP. Severe hypotension. Okay, severe hypotension can be there, so therefore they should not be used along with nitrates. There has to be a gap. Now, because sildenafil is a shorter acting drug, so at least till 24-hour gap has to be there. Tadalafil is a longer acting drug. So when you're giving, let's say patient has to be given nitrates, at least 3 to 4 days gap has to be there between these two drugs, right? So this is, now vardenafil, tadalafil, they have the advantage that they do not inhibit phosphodiesterase 6. So they will not have that problem of vision, but it will be there with sildenafil. Then we have another phosphodiesterase inhibitors called as dipyridamole. So dipyridamole, so it is going to inhibit the phosphodiesterase enzyme in the platelets. Okay, so they have an antiplatelet effect, and therefore they can be used in transient ischemic strokes, TIAs and all, to prevent any claudication वहाँ पे. ठीक है? Yeah, yes, anti-anginal as well as antiplatelets. ठीक है? So they can be used prevent any restenosis को prevent करने के लिए. That's I said ना, TIA, in transient ischemic attacks में you can use them. The reason is because they have a inhibitory effect on the phosphodiesterase. So they increase the levels of cyclic AMP. So they increase the levels of cyclic AMP in the platelets, and this cyclic AMP has a anti-aggregatory effect. मतलब ये platelet की aggregation को it will stop. Yes, it causes the coronary steal phenomena. Definitely, yes, Dr. Mitrovic, you are absolutely right. It also causes the coronary steal phenomena. So this is an example of a drug causing the coronary steal phenomena. Okay? Even we have another drug which is silastazole. That is also a phosphodiesterase inhibitor. So जो silastazole है, that is also a silastazole. and this is used in intermittent claudication, Raynaud's disease वगैरह में, peripheral vascular disease में you can use them. So these are your important phosphodiesterase 3 inhibitors. So we have done in brief what are they, right? Let's move on to the next question. Drug of choice for hyperthyroidism in the first trimester of pregnancy. Okay, so this is the first trimester of pregnancy. Yes, you can write that. So that's also there. They have. I just told you the important ones. Okay, so these ones are the most common. First trimester. Okay, Ankita says PTU. Pranav says 3. C33. Yes, excellent, all of you. Very good. It is propylthiouracil. So if you get a question like this, if it is very clear cut mentioned ki first trimester of pregnancy, then you will write propylthiouracil. In case there is no trimester mentioned, only it is written drug of choice for hyperthyroidism in pregnancy, even then you should write propylthiouracil. Only if it is specifically mentioned second or third trimester, then you write this one as the answer. Otherwise, your answer invariably should be propylthiouracil. Now, carbimazole, methimazole, these are also thiamide drugs. They have the same mechanism, but the problem is that they have a teratogenic effect. Now, carbimazole is a pro-drug for methimazole. Pro-drug for methimazole. So carbimazole is also available. Methimazole as such is also available, right? So what it does in the fetus is, you remember this mnemonic. The carbimazole, what is teratogenic effect? क्या है इसका? Cafe. CAFE. Cafe is the teratogenic. Very good. Aplasia cutis. So it also causes choanal atresia, aplasia cutis, fetal goiter, esophageal atresia. These are the important teratogenic effects. Now, aplasia cutis, cutis means skin, aplasia is deficiency. So यहाँ पे if you see here, skin नहीं है, ठीक है? So there is deficiency of the formation of skin properly. So these are the important teratogenic manifestations that in a child which can occur. This is one part of the question. Now, because the question has been asked on the topic of hyperthyroidism, so it means you should know about other drugs which are also used in hyperthyroidism. So briefly, let's do them because next time they might ask you about some other drug. Now, tell me the mechanism of action of propylthiouracil. Tell me the mechanism of action of propylthiouracil. Mechanism of actions are very important. Mechanism of action of propylthiouracil as well as carbimazole, methimazole. So they belong to the same group of drugs. Please tell me the mechanism of action. Which enzyme it inhibits? Which enzyme? Very good. Very good, Dr. Metroid. Yes, conversion of, that is another also effect. T4 to T3, not T3 to T4. Okay? It is T4 to T3. Peripheral conversion. Because ultimately active form, Dr. Rajay, is the T3. तो ये T4 को T3 में convert करेगा, not the other way around. So it inhibits the enzyme, very good, thyroid peroxidase. That is one important mechanism, inhibits the enzyme thyroid peroxidase. So therefore, inhibition of the formation of or synthesis of T3 and T4, that is one. And second mechanism, which is not seen with carbimazole or methimazole, only seen with propylthiouracil, is inhibition of the peripheral conversion. Thank you. Peripheral conversion of T4 to T3. T3 is, remember, the active form. So inhibits the peripheral conversion of T4 to T3, right? So T4 is the inactive form, but it is the amount of T4 formed is much more as compared to T3, but ultimately T4 gets converted to T3, which is the active form which is going to produce the effects. So this is only seen with propylthiouracil, not with carbimazole or methimazole. Okay? So that is another important thing. Now, what is the mechanism of action of iodides? Mechanism of action of iodides. What is the mechanism of action of iodides? You know, these are the fastest acting drugs. Fastest. Very good. Yes, it inhibits the release of T3 and T4 of the thyroid hormones. And this is also called as, yes, vascularity is the second thing. And it is called as thyroid constipation. So this is called as thyroid constipation, which is inhibition of the release of T3 and T4, thyroid constipation. Okay? And these are one of the fastest acting drugs. And yes, they also decrease the vascularity. Okay? So also decrease the vascularity of the gland. So they are given just before the surgery. Okay? Before the surgery, they are given so that the gland becomes less vascular. Also the levels of the hormones, they go down and it is easier to perform the surgery. और हम कौन सी देते हैं? Lugol's iodine. ठीक है? Now, these are the important things about the anti-thyroid drugs. Now, another question here is, which anti-thyroid drug is the drug of choice? Yes, bleeding is less. Which anti-thyroid drug is a drug of choice for thyroid storm? Out of these, which anti-thyroid drug is a drug of choice for thyroid storm? कौन सी है? Drug of choice for thyroid storm. Which anti-thyroid? Very good, Dhaval. Very good, Dr. Metoy. It is the propylthiouracil. It is a drug of choice, anti-thyroid of choice for thyroid storm. Otherwise, we use beta blockers as a drug of choice. But अगर anti-thyroid पूछा जाएगा, which is the anti-thyroid of choice, then it is your propylthiouracil. So these are some important points about the anti-thyroid drugs. Very good. Let's move on to the next question. ठीक है? Now this one. Which of the following is a SERD or a selective estrogen receptor downregulator? Which of the following is a SERD or a selective estrogen receptor downregulator? Dr. Betroy says 2, fulvestrant. Ankita says 3, tamoxifen. Omkar says tamoxifen. Bharat says 2, fulvestrant. Please do not get confused between SERM and SERD. ठीक है? This is selective estrogen receptor downregulator and ये होता है selective estrogen receptor modulator. जितने भी ये फेन्स हैं, tamoxifen, raloxifene, they are SERMs. ठीक है? So tamoxifen is a selective estrogen receptor modulator, while the correct option here is fulvestrant. This is selective estrogen receptor downregulator. Selective estrogen receptor downregulator. All right. Now, what is the first option? And इसको आप कैसे you can remember? See, you can easily remember ESTR, estrogen antagonist. You can remember. SERMs are all, they're not antagonists. They can be agonists somewhere and antagonists somewhere. So this is a estrogen antagonist. ठीक है? All right, let me come to the first option. Flutamide. What is flutamide? What is flutamide? Flutamide is androgen receptor. No, not S. It's not an SSRI. It is an androgen receptor blocker or antagonist. ठीक है? Bicalutamide, flutamide. These are androgen receptor blockers. Anti-androgens, androgen receptor blockers. ठीक है? Flutamide is used mainly for prostate cancers. Prostate cancer. ठीक है. Now, fulvestrant जो है SERD, it is a selective estrogen receptor down regulator, which means it actually decreases the number of estrogen receptors. ठीक है. And कहाँ पे use करते हैं fulvestrant? Post menopausal breast cancers unresponsive to tamoxifen. Post-menopausal breast cancers unresponsive to tamoxifen. So we use fulvestrant over there. ठीक है. Tamoxifen, where is tamoxifen used? Tamoxifen is actually the preferred drug for the estrogen or the breast cancers. ठीक है. Tamoxifen is used there and it is a SERM. And what is the meaning of SERM? It is a selective estrogen receptor modulator. So somewhere it is agonist and somewhere it is antagonist. That is the meaning of a SERM. So tamoxifen is going to be the major problem with tamoxifen actually is because it is an agonist on the endometrium. So side effect or adverse effect of tamoxifen is your endometrial hypertrophy or hyperplasia. So it can increase the chances of endometrial cancer. Tamoxifen के साथ this is a major disadvantage. ठीक है? And it is used in CA breast. Yes. Yes. All right. इसी से मिलता जुलता there is another drug that is your raloxifene. ठीक है. So raloxifene is approved for postmenopausal osteoporosis. Postmenopausal osteoporosis also can be used in breast cancers. One major इसका use है postmenopausal osteoporosis. Yes. Then let me write here now. The other drug which is important is ormeloxifene. Can anybody tell me the use of ormeloxifene? Ormeloxifene. And what is the other name for ormeloxifene? Scent chromen. ठीक है? Remember this. Scent chromen. Ormeloxifene used for, very good Ankita, contraception. So these are the important terms that you should be knowing. ठीक है? Now the last one यहाँ पे option था clomiphene citrate. Clomiphene citrate. So where is clomiphene citrate used and what is it? Very good. It is used, clomiphene citrate is used for, it is an inducer for ovulation induction. Yeah. For ovulation induction. ठीक है? So it is an estrogen receptor antagonist at the pituitary mainly. So it is used for ovulation induction in anywhere in infertility या जहाँ पे भी where you want ovulation induction. और इसमें एक rule of 5 you remember, 50 milligrams for 5 days. ये इसका डोज हो जाता है 50 milligrams 5 days starting on day 5 of the menstrual cycle. ठीक है? So this is the rule of 5 that you can remember. So ये कुछ important points थे about this. ठीक है? Yes, but इसका ज़्यादा role is also there. Metformin is also used now for the PCOD. वो insulin resistance कम करती है in those cases, and also there is another role, weight gain because PCOD में ज़्यादा होता है, it can decrease that. ठीक है? So metformin is also used for, second use is also PCOD. Coming to the other question now. Which of the following drug leads to obesity? Which of the following drug leads to obesity? Bharat says 2, metformin. Okay. Double, Dr. Petroid, they say 4, pioglitazone. Ankita says 3, sitagliptin. 2, alright. Pio. Why? Because they cause sodium and water retention. Sodium and water retention. So therefore they are contraindicated if already a patient has congestive heart failure. ठीक है, hypertension, congestive heart failures अगर है already, then we should not be using these drugs. Coming to decrease in the weight. Decrease in the weight, metformin, ठीक है, bigonide metformin, GLP-1 agonists. GLP-1 agonist. I got disconnected. All right. What do you want me to repeat? Increase in the weight. Increase in the weight is sulfonylureas, thiazolidine diones. Okay, and thiazolidine diones, what they do basically, they cause sodium and water retention. That's why there's an increase in weight. So because of this, they should not be actually given to patients who already have CHF or hypertension because of sodium and water retention property, right? Now I was discussing the decrease in the weight. Yeah, Abhi, I'm only talking about actually the anti-diabetics, right? So we are only on this thing. We're not talking about anti-obesity drugs as such. I'm only talking about the anti-diabetics which have an influence on the weight. क्या weight पे इनका effect है? Increased or decreased weight? Not, I'm discussing the anti-obesity. I'm not discussing. So decrease in the weight is seen with metformin. It can be seen with GLP-1 agonists. ठीक है? GLP-1 agonist, yeah, right. Exenatide, yes, liraglutides, all these glutides. Liraglutide is approved for this, okay? So GLP, all the tides here, not the tides which are in the sulfonylureas. These are the other tides, okay? GLP-1 agonist. Then SGLT2 inhibitors. SGLT2 inhibitors, gliflozins, right? So they can also lead to decrease in the weight. And then we can have pramlintide. Pramlintide, because they increase the satiety, hunger they will, yes, they will settle down, or they will satiation जिसे कहते हैं ना, hunger उसको produce करेंगे. Then acarbose can also lead to loss of weight. So all these cause a decrease in the weight. And gliptins जो है, your DPP4 inhibitors, they are weight neutral, so they don't have much effect on the weight. So the anti-diabetics influencing the weight, these are the major drugs which are influencing the weight. Okay, so these are the important points that you should know about weight issues with these anti-diabetics, right? Or इसमें अगर हम, if we talk about the options here, so let's go to back to the options and discuss the other options. What is important about each of these options? Now, the first option here given to us was acarbose. So, what is the mechanism of action of acarbose? What is the mechanism of action of acarbose? It inhibits the enzyme alpha glucosidase. ठीक है? Alpha glucosidase, and it will inhibit the intestinal absorption of the carbohydrates. So it will not allow complex carbs to turn into simple. Yes, alpha glucosidase inhibitors, acarbose. So other drugs are voglibose and miglitol. And the most common side effect which is seen with this drug is flatulence. Flatulence. Now coming to the next one is metformin. So metformin is a bigonite. Yes, bloating, flatulence is the same. Bigonite, it will stimulate AMP kinase, and this was going to inhibit, very good, gluconeogenesis and glycogenolysis. Both of these are going to decrease, so that will decrease the levels of glucose and also decreases the resistance. Insulin resistance is decreased with this drug. Okay, so there is less chance of hypoglycemia. Any drug which causes release of insulin has more chances of causing hypoglycemia, like sulfonylureas, insulin itself, yeah, thiazolidinediones. The other drugs have less chances of causing hypoglycemia. Okay, so what are the common or most important adverse effects of this drug? Most important adverse effect of metformin. Most important adverse effect. Very good. Lactic acidosis. Very good, Ajay. Yes, lactic acidosis. One is lactic acidosis, and the second one, it can also lead to megaloblastic anemia. Lactic acidosis, megaloblastic anemia. You know that there was a bigonide which was fenformin. Fenformin was banned because it has a great tendency to cause lactic acidosis. Okay? But metformin has a lesser tendency to cause lactic acidosis. So until unless patient has some kidney disease, some liver disease, right, COPD, any those conditions, otherwise lactic acidosis chances are less. But it was very common with fenformin. Or fenformin was banned now. It is not no longer used because of this problem of lactic acidosis. Okay. All right. And I already हमने पहले भी किया है कि this is also used for PCOD. Another drug which is also used for PCOD. Yes, alcohols. People who was taking alcohols. Now coming to the third drug, which is your gliptins. And you know this time अभी I think INICT में gliptins पे question आया था, ठीक है? So DPP4 inhibitors which increase the level of GLP and GIP. Which are those drugs? These are your gliptins because they inhibit dipeptidyl peptidase enzyme DPP4, which is responsible for metabolism of GLP and GIP. So these are the drugs, all the gliptins. Okay, so it becomes one of the important group of drugs to study more. So gliptins are contraindicated in case of renal disease, except which gliptin is safe in renal failure? Or let me ask this. Which gliptin is safe in renal failure? All the others are not given in renal failure. Very good, Dhaval. It is linagliptin. It is linagliptin. Linagliptin. And which is the most common side effect seen with gliptins? Very good, everybody. Which is the most common side effect seen with gliptins? Most common side effect is nasopharyngitis. Nasopharyngitis, ठीक है? Most common side effect seen with gliptins is nasopharyngitis. Common, most common. ये आप याद करो. Nasopharyngitis is most common. All right. So this was. अब glitazones के बारे में. अब let's talk about glitazones a bit. ठीक है? Thiazolidinediones. They act by what mechanism? Act by what mechanism? They are PPAR gamma stimulators. PPAR gamma, very good. Stimulators. ठीक है? PPAR gamma stimulators, and they will reverse the insulin resistance. Basically, that's their main role. Okay, na? All right. Now, what is other thing is important? Out of these glitazones, there was a drug called as troglitazone. Why was that withdrawn? Troglitazone. Why was that withdrawn? Why was troglitazone withdrawn? Yes, because it was very good. It was hepatotoxic. Okay. So one important thing we've done about glitazones is that it is contraindicated in CHF. This is important. Troglitazone was withdrawn from the market because of hepatotoxic effect. The other thing, they are associated with increased risk of fractures. Increased risk of fractures. तो अगर आपको question आएगा, अगर same options में the question which of the following anti-diabetic leads to increased risk of fractures, this is your glitazones. ठीक है? So they have increased risk of fractures. Right? Yes, bladder carcinoma is pioglitazone has been found that it is associated with bladder cancer. ठीक है? Pioglitazone का है. And rosiglitazone इंडिया में इसलिए यूज नहीं करते because of the risk of myocardial infarction. Otherwise, pioglitazone has been associated with yes. ठीक है? So let's go to the next question now. Now this was in Jan FMG 2023. ठीक है? So all of you should be able to answer this. Which of the following drugs acts at the site marked by a red arrow as shown in the diagram? And I hope you can see the red arrow. This is the arrow. Red arrow. Which is the red arrow here? This one. Okay, the answer. Alice Kiran, very good. All of you are correct. This is Alice Kiran. Because this is a renin inhibitor. REN is spelling में. This is a renin inhibitor. No, not this one. ठीक है? Alright, let me give you the other options. Let's say if the arrow was here. ठीक है? This one. Which of the options would be correct then? अगर arrow इधर हो जाता? Ramipril. Very good, very good. This is a ACE inhibitor. Ramipril. All the prils here. Yes, Ramiprils. Now let's say the arrow would have been, let's say यहाँ पे I make a receptor. And I put the arrow here. Now which would be the option now? 81 receptor I've made and I put the arrow here. No, not spironolactone. No, no. Yes, angiotensin receptor blocker. तो कौन सा इसमें है angiotensin receptor? Yes, sartans, all your sartans. So this would have been the option here. Now, I put the arrow somewhere here. So कौन सा रह गया इसमें? Your spironolactone. Losartan for this one. Now let me mark it here. So this is site number 1, site number 2, site number 3 and site number 4. ठीक है? So site number 4 का option is spironolactone. Very good. This is your aldosterone antagonist spironolactone. So very important that renin angiotensin aldosterone system that you have to know. So important things हम क्या क्या करेंगे? एक आपका हो गया renin which is released from the JG cells. ठीक है? Acts on the angiotensinogen. Angiotensinogen is released from the liver. It converts angiotensinogen to angiotensin 1, angiotensin 1. Then comes the role of ACE. ठीक है, ACE, angiotensin converting enzyme, which is released from the lungs, converts angiotensin 1 to angiotensin 2. Angiotensin 2 is then going to produce effects. Most predominant effect is vasoconstriction, and the other thing, it will go to the adrenal gland and it will cause the release of aldosterone. रेनिन कहाँ से रिलीज होता है? JG cells of the kidney, right? Now aldosterone. And how does angiotensin 2 act? The most important receptor for to you to know is AT1. ठीक है? AT1. Yes. So aldosterone is released. It will go back, act on the kidneys. It will cause sodium, water retention, right? And what is the second effect जो होता है इसका aldosterone का on the heart? Leads to ventricular remodeling. ठीक है? So ये इसका important है, ventricular remodeling, one of the causes of mortality in CHF, congestive heart failures, right? So here, now what are we going to target now? Different sites. Please remember the different sites of action here. Another site I'm going to act here is this. So which is the drug, let's say I am putting, which inhibits the release of renin? Which is the drug which inhibits the release of renin? Yes, when it causes retention, it will cause the release of potassium ions. Okay? Very good. Beta blockers. So one target here is your beta blocker. Second target अभी हमने किया renin inhibitors. ठीक है? So we have aliskiren, enalkirins, right? Then the third target is ACE. So here comes your ACE inhibitors, all your prils. ठीक है? All your prils. So ACE inhibitors, very, very important drugs to know. Then the fourth target is here, which is your angiotensin receptor blockers, sartans. So fifth target is somewhere here, which blocks the effect of the aldosterone on the aldosterone receptor. And these are your aldosterone antagonists. Like spironolactone, eplerenone. ठीक है? Eplerenone, and we call them, yes. Very okay. So these are your main target sites for this. So कोई भी question according to this आएगा, so you have to mark the drugs this way, right? Right. Now, because this is very, very important topic, diuretics asked time and again, whether it is a RAS or the proper question on diuretics. So we are going to study this in more detail about the mechanism. The second important picture here is this one. Okay, so this is not a I'm just I want to ask you the target sites. Very important. Again, it was asked कि एक target sites mark किया था, and which of the diuretics act on which particular site. ठीक है, so this is the first site. Let's go one by one. This is the second site. This is the third site. This is the fourth site, and this is the fifth site. So let's go one by one. First site. Which is the drug which acts on site number 1? Proximal tubule. Which is the drug diuretic which acts on site number 1? Very good, Varun. Very good, Rohit. Yes, no, not spironolactone. Yes, spironolactone causes gynecomastia, eplerenone does not. Okay, so this one is for carbonic anhydrase inhibitors like acetazolamide. Very good. Second site, which is your PCT as well as the loop of Henle, the initial part, descending part, which is the common site of diuretic. Kids, diuretic common site. Yes, knowledge is eternal. Excellent. SGLT2 inhibitors. I'm asking about diuretics right now. Okay, diuretics. Mannitol. Very good. It is your osmotic diuretics. Osmotic diuretics. Mannitol. Excellent. Let's come to the third site. Ascending limb of loop of Henle. Furosemide or your loop diuretics. Fourth site. Very good. Fourth site. Right, right. Loop diuretics. So let's go on to the fourth site. Site number 4. Very good, Vinodhan. Thiazides. Distal tubule. Thiazides. Excellent. Let's go to the fifth site. This one. Collecting duct. Fifth site. Yes, thiazides. All of you are right. Yes. So here you can have your aldosterone antagonists or the cells which are acting on the epithelium sodium channels. Okay? So if you remember COLTS, a mnemonic to remember the sites one by one. C is for carbonic anhydrase inhibitor, osmotic diuretic, loop diuretic, thiazides, and spironolactone. You'll remember aldosterone antagonist. So this is how you can remember the sites of action which have been asked, which have a tendency to be asked again. So sites of action of the various diuretics. The second important thing here for you to understand, or let me take it in a quiz format. Let's discuss important one-liners about these drugs. Chalo. Now, this should be actually rapid fire. Most potent loop diuretic. Which is the most potent loop diuretic? Very important one-liners. Most important loop diuretic concept. Fast. Furosemide? No. Very good. Yes, Dr. Metoid. It is bumetanide. Bumetanide. Not furosemide, but bumetanide is the most potent loop diuretic. Alright. Maximum hypokalemia caused by. Maximum hypokalemia is caused by which diuretic? Maximum hypokalemia is caused by which diuretic? Very good. Carbonic anhydrase inhibitors. Because in the PCT is a place where there is maximum reabsorption of sodium takes place. ठीक है? So maximum hypokalemia भी वहीं पे उन्हीं drugs से होता है. So carbonic anhydrase inhibitors. Great. Third, diuretic which works from the basolateral part of the nephron. Diuretics which work from the basolateral part of the nephron. Mostly they work from the luminal part. Which is the diuretic which works from the basolateral part of the nephron? No, not loop, thiazide. They all need to go into the lumen to act. Very good, Dr. Matoy. It is spironolactone or aldosterone antagonist. Aldosterone antagonist. Spironolactone is one example, right? So just write it down somewhere. Highly ototoxic diuretic. Highly ototoxic diuretic. Highly ototoxic diuretic. Carbonic anhydrase inhibitor, no. Highly ototoxic diuretic. No, you have to name that diuretic. It's highly ototoxic. Uh, no, no, no. ओटोटॉक्सिक ईयर, ई स्टैंड्स, ई से ईयर होता है, ई से उस ड्रग का नाम शुरू होता है. वेरी गुड, यस इट इज एथाक्रेनिक एसिड. ठीक है, एथाक्रेनिक एसिड इज अ हाईली ओटोटॉक्सिक डायuretic. All right. Diuretics which can be used in renal failure. Yes, it is ethacrenic acid. Diuretic which can be used in, yes, which can be used in renal failure. Chlorthalidone. Yes, loop diuretics. One is, yes, very good. Yes, there are two. One is loop diuretics. They can be used. And the only thiazide diuretic which can be used in renal failure. Thiazides otherwise cannot be used in renal failure. Below the GFR of 30 and all, they cannot be used. But the only thiazides which can be used is metolazone. ठीक है, सो ये दोनों हैं which can be used in renal failure. Diuretics used in calcium stones. Diuretics used in calcium stones. So this calcium stones जब पूछा जाएगा, that means it is formed in the kidneys, so in the urine, which leads to, there is a formation of calcium stones. Very good, very good, very good, Rohit. It is thiazides. Why? Because thiazides, they cause retention of calcium. They cause hypercalcemia but hypocalciuria. So they decrease the release of calcium in the urine. Okay? So therefore they can be used in the stones. They preserve calcium, they decrease its loss. जो loss करते हैं, they are your loop diuretics. Loop diuretics leads to hypocalcemia and thiazide leads to hypercalcemia. This is a very important difference that is asked often, that which is used in calcium stones. ठीक है? All right. Some more important ones because they are the questions of the previous exams. Diuretic used in nephrogenic diabetes insipidus. Nephrogenic diabetes insipidus. Hypocalcemia is caused by loop. Yes, hypocalcemia is caused by loop. No, amiloride is for lithium-induced diabetes insipidus. Yes, diabetes in nephrogenic is thiazides. ठीक है, thiazides. Yes, it is thiazides. Now, diuretic of choice in pulmonary edema. Pulmonary edema, diuretic of choice. Which is the diuretic of choice in yes, very good. It is furosemide. ठीक है, furosemide or loop diuretics, they are used in pulmonary edema. No, it is not this one. Diuretic of choice in cerebral edema or acute congestive glaucoma. Diuretic of choice in cerebral edema, very good, very good. Yes, Dr. Meghalith, it is mannitol. Yes, excellent, all of you. Mannitol, osmotic diuretic. Now, diuretic used in lithium-induced diabetes insipidus. Lithium-induced diabetes insipidus. Very good, Varun. It is amiloride. Amiloride, excellent. Very good, knowledge is eternal. Excellent, all of you. All right, diuretic which is contraindicated. Contraindicated in CHF, cerebral hemorrhage या pulmonary edema. Diuretic, Dr. Megharith, excellent. It is mannitol. Mannitol, contraindicated in these conditions. Very good. Now this was another question, very latest question here, which is used in dialysis disequilibrium syndrome. Which is used in dialysis disequilibrium syndrome. Diuretic used in dialysis disequilibrium syndrome. Ankita says mannitol. Very good, Ankita. It is mannitol. Yes, it is mannitol. Now, the last one इसमें है diuretic which is used in mountain sickness. Diuretic used in mountain sickness. Very good. Acetazolamide. So ये कुछ important, extremely important one-liners for the chapter of diuretics. ठीक है? So we have quickly revised diuretics through these 3-4 slides. All right. Let's get on to the other topic here, and you have to tell me the drugs which are acting on site 1 and 2. 1 and 2. Name of the drugs acting on site 1 and 2. You have to tell me कौन सा है 1 and 2. Now disulfiram is on which site? 1 है या 2 है? So you can write 1 and then the name of the drug, 2 and then name of the drug. There are 2 sites here mentioned, right? So which of the drug Dhaval says 2. All right. 2 किस पे? Disulfiram 2. Excellent. So this one is disulfiram. Yes. What about 1? What about 1? One. Methanol? No. Methanol, why will you use methanol? Methanol तो use ही नहीं करते. It's not drinkable actually. Very good, Dr. Meto. It is fomepizole. It is fomepizole. ठीक है? So 1 पे है fomepizole, 2 पे है disulfiram. So fomepizole is a drug which can be given as an antidote for what? किसका antidote है ये? Fomepizole. Poisoning due to what? Not ethanol. Methanol poisoning. Ethanol poisoning नहीं, it is methanol. Overdose में हम दे सकते हैं methanol poisoning basically. Poison अगर हम बात करें तो it is poisoning is with methanol. ठीक है? Because ethanol can be consumed, methanol should not be consumed. Poisoning अगर हम बात करेंगे, yes you can. So इसका treatment is 1, you can give fomepizole, and the second option is ethanol. Because methanol as well as ethanol, they utilize the same enzyme, alcohol dehydrogenase. So if the patient is having methanol poisoning and you give ethanol to that patient, ethanol will preferably utilize alcohol dehydrogenase and methanol will not get metabolized. Okay? So that is the aim. So ये very important to know. So before I go on, let's do the second question from this very chapter and then we'll discuss some important points here. Now tell me this one. All the following drugs are used for detoxification therapy of alcohol except right. Fomepizole is not available in India actually, sadly. So I think so whatever is there, that's the best use. All the following drugs are used. Okay, 4. Excellent. All of you are not 3, Rohit. Detoxification can be any therapy, ठीक है? Whether it is your aversion therapy है, whether you want to decrease the craving or overdose, anything. So all the following drugs are used for detoxification except it is flumazenil. Yes, because flumazenil actually is a benzodiazepine antagonist. It has no role here. So it cannot do anything for alcohol. Okay? So it is a flumazenil is a benzodiazepine antagonist. So this is another question important as such. The various antidotes. You is zaruri hai, so you should know that. Now let's discuss अब अल्कोहल पे जितने इंपॉर्टेंट पुराने क्वेश्चन से लेट्स डू देम. विच आर द ड्रग्स विच प्रिवेंट द विड्रॉल ऑफ अल्कोहल? ये 3 इंपॉर्टेंट चीजें हैं. Naltrexone is not an, it is actually opioid antagonist. ठीक है, naltrexone is an opioid antagonist, so it is a antidote for morphine poisoning also. Right. Drugs which can, yes, benzodiazepine is right, Rohit, but which benzodiazepine? सारी benzodiazepines are not approved, यहाँ पे use नहीं करते. Which benzodiazepine? You very good, Ankita. It is chlordiazepoxide, long acting chlordiazepoxide. और अगर ये ऑप्शन में नहीं दिया है, then the second best option to choose is diazepam. If both are given, then you mark chlordiazepoxide. ठीक है? If one of them is given, then you know what to mark. But if both are given, then you need to mark chlordiazepoxide. Drugs, okay. Alcohol aversion is caused by, yes, disulfiram. By disulfiram. ठीक है? Now drugs which reduce the craving. Which are the drugs which reduce the craving? Yes, metronidazole has a disulfiram like action. Disulfiram की तरह act करता है. It is not a disulfiram. ठीक है? Metronidazole is a drug which acts like disulfiram. That is the difference. Chlorpropamide, ये सारी drugs हैं which have a disulfiram like action. They are not disulfirams. Disulfiram तो एक अलग से drug है. ये जो different drugs हैं, they have a disulfiram like action. वो disulfiram की तरह काम करते हैं. So अगर patient is on metronidazole and patient consumes alcohol, metronidazole is going to block this same enzyme, acetaldehyde dehydrogenase, and it will cause increase in the levels of acetaldehyde because patient has taken ethanol. There will be increase in the level of acetaldehyde. Now, all the unpleasant features of alcohol intake is because of acetaldehyde. If it gets accumulated in the body, patient will have all the unpleasant effects. So there will be a lot of palpitations and those kinds of things, right? So yeah, wannabe disulfiram. So it will cause all those. जब भी patient alcohol लेगा, patient को aversion हो जाएगी. Patient will not feel like taking because the patient is taking this metronidazole. So therefore, when patient is on metronidazole, they are advised to refrain from drinking while on the therapy and even 3 to 4 days after the therapy because तब तक metronidazole will come out of the body. So just mind, it is not met disulfiram, they work like that. इसलिए उसको कहते हैं disulfiram like action. Right, नफरत ही होगी. Okay, हाँ, अभी हम थे reduce craving. So many of you have written acamprosate, yes, naltrexone, okay, all right. ठीक है, अब इसको हम एक we will remember it by a mnemonic. No to, we can say, ठीक है, no, और इसको हम थोड़ा बड़ा करते हैं, to alcohol. So say no to alcohol. So you can remember by this mnemonic. N is for naltrexone. To is for topiramate. ठीक है. O is for ondansetron. And alcohol का A only you remember, it is for acamprosate. ठीक है. They reduce the craving. No to alcohol. So remember these four: naltrexone, topiramate, ondansetron. ये चार drugs हैं which are going to reduce the craving. ठीक है. So remember this. So prevent withdrawal के लिए chlordiazepoxide, diazepam. Aversion cause करने के लिए disulfiram. Please remember, question में पढ़ना है कि क्या पूछा गया है. Withdrawal पूछा गया है, aversion पूछा गया है कि craving पूछी गई है. Your answer will depend on that. ठीक है. So do not get confused. Craving में आप डाइसल्फिराम लिख दो, क्रेविंग नहीं रिड्यूस होती, ठीक है. सो एवर्जन में डाइसल्फिराम है देयर. सो जस्ट लुक एट द प्ले ऑफ वर्ड्स इन द क्वेश्चन. सो ये इसलिए आई टुक दिस बिकॉज बी वेरी क्लियर ऑन व्हाट इज आस्क्ड इन द एग्जाम. Move to dams. Yeah, I can't really comment on the other educators because it keeps happening from app to app. Hopefully, yes, you will see me in the app, right, soon. So in the meanwhile, we are taking classes here. Just that you're not at a loss. So ये free YouTube classes हैं या in app classes जो होती हैं free, whatever. So they are there for you only. ठीक है? So we are going to hold them regularly so you can put you on track and don't lose track on whatever. So any issues, any problems, we'll solve during those classes. ठीक है? Don't worry. I will be coming up with various classes abhi till your exams. Okay. Chalo. All right, let's get to the last question of the day. Very, very important topic again. Drug of choice for digoxin induced ventricular arrhythmia. Session will be uploaded or not? I need to check this. Uploaded. It is available here only on the YouTube. It will be there if you want to see that. ठीक है? आप देख लो इसको, ठीक है? Okay, drug of choice for digoxin induced ventricular arrhythmia. Lidocaine, excellent. This is the answer. Amiodarone, lidocaine, 2 is lidocaine. Yes, so almost all of you are correct here. It is lidocaine. Now, digoxin toxicity. Digoxin is a drug जिसके बारे में you should know left, right and center. ठीक है? So everything is important about this drug. Digoxin toxicity. No, it's not amiodarone. It is lidocaine, drug of choice. So एक तो levels more than 2. If it is given, then it is digoxin toxicity. Right? Half-life of digoxin is 40 hours. ठीक है? इस बार एक क्वेश्चन था, न्यूमेरिकल बेस्ड क्वेश्चन था, that the level of digoxin was 4. So, and the half life was given 40 hours. How much time would it take for the level to come down to 2 basically? ठीक है? So that was the question. So ये आप याद रखना कि 48 hours is a half life, and इसमें simple था that one half life or maybe there was 2 half life, something like that, but simply आपने half life ही add करनी थी उसमें. ठीक है? So ये एक important चीज हो गई यहाँ पे. Now let's get on to the other important things. The earliest and the most common toxicity seen with digoxin. Earliest and the most common toxic side effect. Earliest and most common toxic side effect. कौन सा है? Very good. GI upset. So it is nausea and vomiting. Nausea and vomiting. Most common is nausea and vomiting. Most common arrhythmia. Most common arrhythmia. Yes, Ankita. Yeah, it is this. Dr. Meghrat, I think I'm not sure about uploading of this. You can talk to them कि ये upload होगा अभी कि नहीं होगा. I am not sure about this because YouTube sessions हैं. Let's see. ठीक है? As long as it's there. Most common arrhythmia is ventricular bigeminy. Most common arrhythmia is ventricular bigeminy, which is the vision defect seen with digoxin. Vision defect seen with digoxin. Eye में, what is the side effect in the eye? Very good. Yellow vision, xanthopsia. Yellow vision or xanthopsia may be important. So these are all important. Then now the treatment part. Ventricular arrhythmia, the treatment is हमने किया lidocaine. ठीक है? Lidocaine. Atrial arrhythmia, Atrial arrhythmia, the treatment is digoxin-induced atrial arrhythmia. The treatment is, because the aim here is to decrease the impulses from atria to ventricle. So we need a drug which will cause the AV block. AV blockers. So basic यहाँ पे हम बीटा blockers use करते हैं, ठीक है? AV बीटा blockers. Already अगर AV block कर दिया इसने, then what do you use? AV block. Digoxin-induced AV block leads to what treatment for AV block? Right, AV block का treatment. Beta blocker will not be able to help in AV block. Atropine, ठीक है? Atropine. Severe toxicity with digoxin. What is the antidote? Severe toxicity with digoxin. What is the antidote? Severe toxicity, very good. It is digibind. Digibind or digifab. ठीक है? These are all the digibind, digifabs. ठीक है? So ये है important treatment and the common toxicity seen with digoxin. Now और ये जो तीन चीजें हैं, which of the ions and their relation to toxicity, again very important. So hypokalemia and hypomagnesemia, that increases the digoxin toxicity, and hypercalcemia will also increase the digoxin toxicity. ये भी very very important. ठीक है? ये whole as such is very important. So very soon I'm be taking a class on the various antidotes, and we are going to discuss that because they are very important antidotes you should know. So all the important antidotes, we will be discussing them as questions, and what are the important points or pointers you should know about each one of them. All right, so with this we come to the end of today's session. So these were certain important few more questions that you should be knowing. So see, please remember, MCQ is not just about doing that MCQ. It is every other option around that MCQ. Okay, digoxin mechanism of action. Yes, you can see digoxin, what it does is, so there is a sodium potassium ATPase, you know this, sodium potassium ATPase pump है, ठीक है? And there is another thing I will say, there is a exchanger, sodium calcium exchanger. Sodium ATPase pump, sodium calcium exchanger. Now what is the role of this sodium potassium pump? What is the role of sodium potassium pump? Sodium has to, what does sodium do? क्या होता है सोडियम पोटेशियम पंप का रोल? सोडियम पोटेशियम पंप का, come on quickly. Yeah, it is blocked, but what is the role of sodium and potassium? Okay, sodium goes out, potassium pumps in. ठीक है? This is a normal mechanism, and this is the heart cell. Now what digoxin does, it will block this pump. So when digoxin blocks the pump, sodium is not able to go out and potassium is not able to come in. So sodium levels are going to be high. Now this exchange works only if there is less sodium, because otherwise अगर sodium पहले बाहर जा रहा था, there would be deficit of sodium inside, so the exchanger would work, sodium would come in and the calcium would move out. But now digoxin ने क्या कर दिया है, इस pump को block. Now sodium is already quite in a high amount here, so sodium exchanger will not work. अब sodium exchanger काम नहीं कर रहा, तो calcium भी बाहर नहीं जाएगा. Calcium बाहर नहीं जाएगा, तो अंदर the calcium levels are going to go high, and then they are going to increase the release of calcium from the sarcoplasmic reticulum, and when the calcium increases, that will lead to the actin myosin contraction. So they increase the contractility. So it's a inotropic agent. So this is The important here is which pump it blocks: sodium, potassium, ATPase, and therefore ultimately increases the calcium levels inside, right? And it will cause increase in the contractility. So therefore digoxin is used in cases of chronic, not in the acute heart failure, but chronic failure में हम use करते हैं. Acute में इसका कोई role नहीं है. In the chronic heart failure में इसको use करते हैं. It works as a inotropic agent. That is the mechanism of digoxin. ठीक है? So therefore you see sodium जो potassium है, इसका competition है. Potassium will be there. So potassium will kind of compete with digoxin. ठीक है? अगर high potassium है, digoxin नहीं लगेगा. Low potassium है, more digoxin will come. So that's why hypokalemia increases the toxicity, increases the binding of digoxin to sodium potassium ATPase. ठीक है? Yeah, calcium is not going out basically. So more calcium inside, more it will be triggering the release of calcium from the sarcoplasmic reticulum. वही trigger होता है, and that is important because contraction के लिए आपको calcium चाहिए. So thank you so much for being here again for your exams. All those who are preparing for this FMGE July. So please, these are really really important. और भी कोई questions है around these topics, go and revise them. ठीक है? Thank you so much. Take care. Have a great evening. See you next time.